My name is Taba Aleem, and I'm from Akron, Ohio. I grew up here, and I work here at Planned Parenthood of Northeast Ohio as Director of Community Services. We do basically family planning, that is birth control, sexually transmitted disease prevention and treatment. We do exams for cervical cancer, early cervical cancer screening, breast cancer screening, do a lot of referrals. We have real doctors and nurse practitioners who work at on our staff in our health centers. When it comes to partnerships, probably our biggest partner on the last, how many years, probably 5 years or more, has been the Akron AIDS Collaborative, who is an grassroots organization in the community that does HIV education as well as testing. And a lot of their tests, once they've done the test, Planned Parenthood supplies the test kits and their results and numbers of people and whatnot, op-scan sheets and forms and whatnot come back through our health center. As well as we have other parts of our organization, including our education and outreach department and our public advocacy. We have integrated HIV testing as a service in our health center. If a person comes in and they're seeking birth control or some other pregnancy test and they request an HIV screening test, then they can get it on the spot. So again, it's an integral part of the services that we provide in our health centers. But when it comes to 50 and over, I think the mindset is the same as very young people, meaning teenagers who might be 14, 16. We tend to think not the people I'm dealing with or going to have a relationship or have intercourse with could be infected. That's for people who are young, who are infected. But us older people, we don't do it that way, and we don't need to use condoms because condoms were not a part of our sex education growing up. And so most of us have been married or in long-term relationships. We're so used to, I've been married for 15, 30 years and whatnot, and my partner may have passed on or I might be divorced, but still I'm in a population with others who have practiced and been with, in one-on-one relationships for so long that you just tend to think that it couldn't happen to us. That's the thinking that's going on with people over 50. We don't need condoms because we are not infected with those kinds of things that happen to young people. The safest thing, of course, is to be in a committed relationship and know your partner and use condoms. And so you would need somebody who's committed to one relationship with you and you to them. That's the best way. And of course, if that doesn't work, then you need to practice abstinence until you can find someone that's willing to be in a committed relationship. And if you're of a nature that you don't want a committed relationship, maybe you're just a freewheeling type person and you like to have sex with different partners, then the best thing, of course, is always use a condom that you've checked out that it works, that you've looked at the expiration date on the condom, it has no tears in it, the condom is intact, and that you use it each and every time, and that you look and make sure your partner has a condom on. So that's the only advice. And then, of course, if you're a woman, then as we age, we also have problems with vaginal dryness. And if a lubricant is not used, then sometimes the dryness of the walls of the vagina, vaginal walls, can maybe tear the condom. The friction could cause the condom to tear, and there might be some issues there. So again, women in general need to talk to their GYN about processes that happens to our bodies as we age. And one is vaginal dryness that not that many people are willing to talk about. I just want the Akron area and the rest of the country to know that HIV certainly doesn't discriminate, and it doesn't discriminate against older people. So again, anyone who's having unprotected intercourse is at risk for contracting HIV, and that you can't know by looking at a partner or because he or she is well dressed and comes from a good background and maybe is a professional or has a good job and they have that part of their life in order that they may not be infected. Yes, they can be. So it's best to know your partner.